When it comes to wound healing, most people think of bandages, stitches, and maybe a little antibiotic ointment. But behind the visible drama of cuts and surgical scars is a microscopic construction site, and zinc is the quiet foreman keeping things on schedule. While not nearly as glamorous as protein powders or collagen drinks, zinc plays a surprisingly central role in rebuilding tissue, especially after trauma, burns, surgery, or stubborn ulcers that just won't heal. So, what's really happening when your body is trying to patch itself up? Wound healing isn't a one-step process. It's a coordinated dance involving inflammation, tissue regeneration, cell proliferation, and finally remodeling. Zinc is involved in nearly all of it. Without it, things slow down, corners get cut literally, and wounds may linger, get infected, or leave more noticeable scars. One of zinc's most important roles is accelerating epithelialization, the process by which skin cells crawl over a wound to seal it shut. Zinc is crucial for the division and migration of keratinocytes, which are the primary cells that form your skin barrier. No zinc, no coverage. Imagine trying to wallpaper a room with half the supplies and none of the glue. That's what delayed epithelialization looks like at the cellular level. But the work doesn't stop on the surface. Deep inside the wound, fibroblasts, the cells responsible for producing collagen and extracellular matrix, are working overtime. Zinc supports their activity too. It helps fibroblasts proliferate, produce structural proteins, and knit the wound together from the inside out. This is especially vital in larger wounds, surgical incisions, or deep tissue injuries where regrowth has to happen in layers. Without adequate zinc, collagen formation falters, the matrix stays weak, and the skin may not regain its full strength or flexibility. Zinc also helps regulate inflammation during healing. You don't want inflammation to disappear completely. It's part of the normal process, but you do want it to subside at the right time. Zinc modulates cytokine levels and stabilizes cell membranes, helping to prevent excessive inflammation, oxidative stress, or tissue breakdown. In simple terms, it helps your immune system help without overreacting and turning the wound site into a biochemical battlefield. This makes zinc particularly useful in people with chronic wounds, like pressure ulcers, diabetic foot ulcers, or venous leg ulcers, where healing is stuck in an endless inflammatory cycle. Supplementing with zinc in these cases has been shown to shorten healing time and improve tissue quality. It's not magic, but it's a much-needed nudge in the right direction. Then there's post-surgical recovery. After an operation, your body is under significant stress, tissues are damaged, and nutritional needs go way up. Zinc requirements increase during this period, not just because of the trauma itself, but because it's being rapidly used up in the repair process. And since surgical patients, especially the elderly or those with chronic illness, often enter the hospital already mildly zinc deficient, recovery can lag behind if this isn't addressed. Burn victims, in particular, may benefit from targeted zinc support. Severe burns cause both massive fluid loss and tissue destruction, and zinc is often lost through exudate. Supplementation in this context can not only speed up skin regrowth but also reduce infection risk by supporting immune function and skin barrier repair. Even mild zinc deficiency can stall the healing process. It's often overlooked in clinical settings, but for patients who aren't healing as expected, checking zinc status should be right up there with checking glucose, protein levels, or infection markers. A few milligrams of the right nutrient can sometimes do what a month of sterile dressings and wishful thinking can't. So whether you're recovering from a cut, a cesarean, a burn, or a biopsy, don't forget zinc. It's the backstage worker quietly driving every phase of tissue repair, from cleaning up the mess to building a replacement. And if you want that process to go smoothly, with less pain, less scarring, and fewer complications, give this mineral its due. Because while stitches might hold a wound together for now, zinc helps make sure the skin knows how to finish the job.